Aspirin, a common medication known for its pain-relieving and anti-inflammatory properties, is widely used across the globe. Among its many applications, it is often prescribed in low doses for the preventative treatment of cardiovascular diseases. However, the use of aspirin in patients with hypertension and diabetes necessitates careful consideration of potential risks and benefits. Hypertension, or high blood pressure, affects millions of individuals and is a significant risk factor for cardiovascular diseases. Aspirin's blood-thinning properties can reduce the risk of heart attacks and strokes, yet it is crucial to evaluate each patient's condition individually. The primary concern lies in aspirin's potential to increase bleeding risks, particularly gastrointestinal bleeding, which can be exacerbated in individuals on antihypertensive medications. Diabetes, characterized by high blood glucose levels, further complicates the scenario. People with diabetes are already at an increased risk for cardiovascular complications. While aspirin may provide a protective benefit against such risks, it is not recommended for everyone. The decision to use aspirin in diabetic individuals must be made cautiously, particularly as diabetes can slow healing processes and heighten sensitivity to drug interactions. Healthcare providers must weigh the individual's overall risk profile, including age, family history, existing cardiovascular conditions, and potential bleeding risks before recommending aspirin. In certain cases, if cardiovascular risk outweighs bleeding risks, a low-dose aspirin regimen may be appropriate. Recent guidelines suggest that daily low-dose aspirin is more beneficial for those with a documented history of heart attack or stroke rather than for primary prevention in all diabetic or hypertensive patients. It is pivotal to consult with healthcare professionals to determine the appropriateness of aspirin, taking into account the latest research and personal health history. Ultimately, while aspirin remains an important tool in the prevention of cardiovascular diseases, its use among patients with hypertension and diabetes should be tailored to each individual's medical profile, with continuous monitoring for any adverse effects. Patients should engage in thorough discussions with their healthcare providers to understand the full scope of benefits and risks before beginning or discontinuing aspirin therapy.